EmBIO, undoubtedly one of the largest IVF and gynecology units in Greece, is located at Haldrei, Athens, 77 Ethnikis Antistaseos Street. With a total area of 3,000 square meters and modern technological equipment, the unit provides a full range of new therapeutic techniques in gynecology, IVF, and mammography. Thanos Paraschos, Director of EmBIO Medical Center. The unit was established in 1997 and has since maintained the privilege to provide successfully high-quality services in the field of assisted reproduction and gynecology, always with responsibility and consistency. Above all, we invest in our patients' trust. Headed by Thanos Paraschos, the medical and scientific staff of the unit is well-trained and, together with the state-of-the-art technology, offers security and confidence. Dina Katrania, Embryology Lab Director. Based on our experience and dealing successfully with at least 2,000 cases a year, we are able to fully understand the needs of couples facing the problem of infertility. Ultrasound monitoring can be done in almost every city in Greece or abroad, with the results transferred directly to us in confidence. In our private medical facilities, with a total area of 3,000 square meters, we use contemporary and safe technology to provide health and family well-being. Right from your first visit in our hospitable and friendly environment, you'll feel that a solution to your problem will be found. Our greatest satisfaction is the smile of the people who leave our medical center having achieved their desired goal. The convenience of the rooms, the simplicity and luxury create a pleasant atmosphere that goes beyond the aesthetics of ordinary outpatient clinics. Our medical and scientific staff, obstetricians, etc., are always available to inform you on all the stages of the IVF procedure that we'll use for your case. On the first floor of EmBIO Center, there are 5 independent examination rooms, equipped with the latest generation of ultrasound, allowing automatic recording and processing of data in the operating system. Step by step, the IVF procedure leads to pregnancy, with all stages thoroughly monitored. The blood collection unit on the same floor is autonomous and fully equipped. Resuscitation is done in a special vestibule near the surgery, with fully organized cardiac and respiratory revival, always under the supervision of an anesthesiologist. Thus, each patient is treated individually, with a full team working for her. The unit has 4 autonomous contemporary operating theaters, supported by corresponding anesthesia equipment of the latest technology conforming to the latest international requirements and specifications. The operating rooms are equipped with special projectors and beds with electronic tilt and change position possibilities. All the surgical benches are coated with corian, an inert antibacterial material that does not release any toxic substances to ova or embryos. The unit is also served by 2 lifts, one of which is accessible to people with disabilities. Embryology Laboratory. The laboratory has 17 incubators, 2 microscopes ICSI, 7 analytical microscopes, 4 multi-threaded flow chambers, 3 semen collection chambers. It is supported by a special mechanism that produces quality sterile air under positive Class A pressure. Here, too, all benches are coated with an antibacterial layer. osmometers, a pH meter, centrifuge, precision scales, and special refrigerators for preservation and storage of frozen semen, frozen ova, and embryos are also available. Good laboratory conditions are ensured by the special air filtration system that minimizes noise and vibration. Under the center's thorough organizational system, a precise inventory is kept of the equipment, samples, and consumable materials. All data are collected and stored in a secure central database to be analyzed later. All files are copied on a central data system and recorded on DVD for safety reasons, always in the context of medical confidentiality. The embryology laboratory is equipped with a modern micromanipulation microscope that provides images of high resolution and clarity. All the tools, procedures, pictures, and comments are recorded, providing a complete history of in vitro ova and embryos. Multi-threaded flow chambers ensure stable temperature control of environmental conditions, and even the positioning of the microscope in a special shock table is of importance, since optimal conditions for ICSI are thus achieved. It is worth noting that all our equipment and the center's software are designed in such a way so as to comply with any requested operational requirements and those proposed by the relevant European directive. Our laboratory equipment offers embryologists a pleasant working environment where operational control is easy and ergonomic equipment is of primary concern. The IVF laboratory and the operating theaters are supported by a special mechanism that produces perfectly sterile air under positive pressure. Also, the building is powered by an auxiliary generator with its own electricity substation and special electronic systems to provide timely notification of problems. The electronic storage of results is supported by a cutting-edge information and statistics system used by large plants in Europe and the U.S. It also features a special sterilization and consumable medical supplies storage area and a special space for medical gas cylinders. In the sterilization chamber, we operate 3 autoclaves, a dry sterilization autoclave, and a special wet sterilization autoclave for hysteroscopic and laparoscopic telescopes and instruments. The entire complex complies with all fire and gas safety requirements. Fire extinguishing systems and automatic notification systems are available on all floors of the center according to EU directives. Apart from the in vitro process, our unit is active in the diagnosis of breast cancer. On the ground floor of the building, an autonomous breast center operates with the latest digital mammography machine. Tests are performed using either a high-definition, low-dose digital mammography machine or with breast elastography, a new technique that allows the ultrasound to distinguish a benign lump from suspected malignant lesions by measuring elasticity. For small lesions that are not palpable, biopsy is either surgically done by detection with a wire guide or by percutaneous biopsy with mammotomy and mammography guidance to avoid general anesthesia. In a specially designed area on the 4th floor is the center's auditorium, where doctors and scientific staff discuss patient cases and are informed on matters relating to medical advances in the field of in vitro fertilization using a special screen and electronic image transfer system. On the same floor, meetings and teleconferences are conducted with other centers and scientists abroad. Finally, it is worth mentioning that in order to serve couples visiting our facility, there are a total of 70 parking spaces on levels 2 and 3.